Pop quiz number 5. An older adult client was admitted 2 days ago with a fractured hip. Upon assessment of the client's vital signs, you note the client to be confused, to have tachypnea, and to be restless. What is your best first action? A. Administer oxygen. B. Notify the physician. C. Slow the IV flow rate. D. Discontinue the pain medication. And guys, the correct answer is A, administer oxygen. So the first clue was that the patient had a hip fracture. Whenever a patient has a fracture, they're going to be at risk for developing clots. They're going to be at risk for embolisms. If it is a long bone fracture, they're going to be at risk for a pulmonary embolism. Like I said in my last video, this is a medical emergency, okay? You suspect a pulmonary embolism and it tells you the patient's confused, they have tachypnea. Why do you think the respirations have increased so much? Why do you think they're restless? The reason they're restless is because there's not enough oxygen going to that patient's brain, right? So what are you going to do? You're going to give them oxygen. Don't choose notify the physician. When you choose that answer, you're telling the test writer that while your patient's dying, while they're in a hypoxemic episode, that their brain is literally dying because it's not getting enough oxygen, you're over here on the phone with the doc to tell them what? You better give that patient oxygen.